good afternoon, I guess, right now. And welcome to another edition of our Facebook Focus Live. My name is Dr. Hussein Kermali, Chief Medical Officer here at St. Mary's Hospital, part of Trinity Health of New England in Waterbury, Connecticut. Each month we highlight a different service line that we offer here at St. Mary's and to the Waterbury community, providing a little bit of insight and personal exposure to our providers here for our patients in the community and across the city and across Connecticut. Today, I am excited to welcome on Dr. Anthony Kim, Tony Kim, as we like to say, one of our wonderful urology doctors. So welcome, Tony.
Thank you. Thank you for having me.
Thanks for joining us today. In the short time that we're here together, we wanted to talk a little bit on focusing on you and your philosophy regarding medicine, and then transition a little bit to what services are available for urology here. So let's start with sort of your background. Go back maybe just a couple of years, back to Boston University School of Medicine with your MD, and your clinical focus was on clinical neuroscience.
That's right. I mean, and that was all prior to medicine, going into medical school. Once again, thank you for having me.
For sure.
I really appreciate it. These things are great because it sort of makes you think and reflect about a time period that sometimes you put in the back of your brain and you forget that you even did the things that you did.
Yeah.
But as a college student, I was always interested in psychology and literature and movies and art, and so when I think about health, like a person's health or anything, the thing that was always the biggest mystery to me was the function of the brain, right? And so it was a really kind of a great opportunity for me to do some research in that, and and my primary focus was looking at a disease called Huntington's disease. I don't know if you know that or are familiar with some of the patients, but it's a devastating disease. Patients, unfortunately, there is no cure for it.
Right.
And if it affects patients in their motor and physical abilities and their cognitive abilities and even psychological issues as well. And so my focus there was trying to apply clinical data to a structural sort of issue in the brain. And so at the time we were using and we're talking in the mid-90s, what was sophisticated brain imaging, which now looking back looks so primitive, but trying to correlate findings that we saw in these brain scans to some of the clinical data that we saw, and trying to find some connection with function and structure of the human body. And so that's what kind of got me into neuroscience. I thought the research was super fascinating. I think there are looking back at it, looking to see going into urology or seeing what I wanted to do clinically, it might not have really fit what I wanted to do as a clinician in some ways, and so I sort of drifted away from that and then discovered urology.
So where was there a connection between neurology and urology? I mean, apart from the name.
Sure.
They're close there, but why did you end up choosing urology?
What I loved about neuroscience or neurology is that, trying to piece together some functional issue in a patient and trying to see if there was a structural reasoning behind it. The thing that I sometimes felt a little bit limited in neurology, and I think it's a fascinating field. I really think there's so much research going on, and it's something that's really benefits patients in a significant way. But in my own sense, I felt limited in the way that, especially in that disease that I was studying, in a way that I would actually cure patients in some ways. So I really like the idea of trying to find a structural problem that is altering the function of a human body and trying to fix that.
Sure.
And I think that's what really appealed to me about surgery, is that you can find an abnormality that may be affecting the structure of the kidneys or the function of the bladder, and you can correct that, fix that, and then help patients be healthier. What I like about whether there's now, as far as a connection between neurology and urology, I think there's a connection with every function or structure of the body, system of the body with the other. And so there is definitely a connection with neurologic issues and urology. And I did like that balance of that too. And I found that sort of fascinating too, the neurologic changes that one would have and how that changes their urologic issues.
Sure.
But I think you can find those connections in every part of medicine, whether it's like cardiovascular neurology. And that's what's really cool about just being a doctor, is that trying to put together, although some of us have specialties in what we do, trying to figure out that puzzle and how it sort of affects the whole body and one's health.
Yeah. And it's amazing and quite coincidental. You talk about neurology. Last night we were at the MS Society dinner, where we were continuing research and continuing funding for that research, which is going great in Connecticut. Of course, we have the MS Mandel Center here in Connecticut, associated with Trinity Health New England. But then we talk about urology and in MS patients, and neuro and how they're connected. And I know you guys do a lot of work from that perspective.
Yeah,
as well.
Absolutely. I mean, Dr. Moy has been very active, and who's my partner, has been very active at the Mandel Center. The problems of the urologic problems that neurology patients have are so prevalent, and sometimes they get overlooked in a lot of ways. And as time goes on, those can cause devastating issues.
Sure.
And so what we're trying to do is establish a program in which we can help patients who have, one, make some awareness as to the urologic issues that neurologic patients would have.
Sure.
And then also to have a system in place in which we can follow those patients in a way that we can maximize their kidney function and maximize their quality of life.
And so I mean, well, I want to clarify one thing. Let's talk about what urology. I mean, I think many people think neurology, they understand brain.
Yeah.
But urology, let's talk about a little bit just on the definition of what that exactly is.
Yeah, so it's a subspecialty that deals with any disorder of the urinary tract.
Right.
And it's a little, sometimes there's some confusion as to what a nephrologist does and what a urologist does. I always look at urology as being more of like structural abnormalities or physical structural abnormalities of the urologic system, whereas the nephrologist looks at more of the the nitty-gritty function of the kidney itself.
Yeah.
And sometimes that's more microscopic in some ways than it is what we do.
Yeah.
But it's a specialty in which we have a huge variety of tools, both medically and surgically, at taking care of any disorders of the urinary tract.
And you say surgery, and I think the advances that have gone on from the 90s, the 20s, the 2010s, and the 2020s, and now we think, when we think urology and urologic surgeries, my mind immediately goes to robotic surgery.
Absolutely. I mean,
tell us about that.
What drew me to urology is that they've always embraced technologic advances that are going on in medicine. And I think they've always really tried to be at the forefront of that, whether it be laparoscopy, whether it be some of the more exciting sort of diagnostic tools that we have with genomics and personalized medicine.
Sure.
That sort of really gravitated me towards going into urology, just because the technological advances are so great. And robotic surgery is one of those things. And I think it's absolutely revolutionized the way that we deal with surgical problems in the urologic system. It's made it such that we can do amazing, complex types of surgeries in the most minimally invasive type of way that has the least impact on the patient.
Yeah.
Sometimes in the old days, laparoscopic surgery was great. Patients did very well with it, but the instruments were so primitive, and sometimes the degree in which we could actually perform the surgery could be impacted on that. Robotics takes that away. It makes it almost seem like you have your hands inside the patient operating. The precision, the visualization, that's made the surgery better. That's allowed us to enhance what we can actually offer to the patient. At the same time, it's given patients that quality of life after surgery, the decrease in their recovery time, their quicker time to get back to the things they like to do, which is really translated into better patient care.
And when we talk about better patient care, you and Dr. Moy specifically have been rated as top doctors in Connecticut magazine for the last 2 years. So what's your philosophy when we think about better patient care? What's your philosophy on that?
I mean, those things are very nice to hear. I mean, I always look...
And congratulations.
Yeah,
I mean, that's fantastic.
You know, I just think, you know, Dr. Moy and I are both like super humble guys. And so, you know, those types of things are nice, but we don't really hang our hats on them. You know, I'm thankful for those people. I don't know how these things get decided, but I'm thankful.
Well, I'll tell you one of those. That's coming up. We've got a beautiful quote right here. I'll interrupt you while I say this. This is from one of your patients who recently shared their thoughts. I am so grateful for all that he has done for me. So thank you. What is so great is his personality, attentiveness, and honesty, and the fact that he didn't delay in the procedures. He got right to the heart of the matter. He walked me through every step along the way and provided me with more information than I have ever had in any healthcare experience. I have nothing but good praise for him. He is my savior. I honestly mean that. I mean, that's powerful.
I'm going to have to send him a gift basket. That was like such a nice thing to say.
Beautiful.
You know, I think, well, one, Dr. Moy and I both, our ethic towards patient care has always been centered around the patient itself. And you know, we're both somewhat personal and approachable sort of individuals that, you know, we enjoy taking care of patients. And you know, what I love about medicine is sort of the problem solving aspect of it. And I love the science of it. I love the clinical problem solving. But the thing that I really, really like, that I find like gratifying and challenging at the same time, is being able to talk to patients in a way that you can break down sort of complex medical jargon or information in a way that they could understand it really smoothly and easily. And so, you know, I like that challenge of trying to like teach, and I look at it like teaching a patient about what's going on. There's so much misinformation out there, whether it be on Google, and there's so many these sort of patient centered ways to explain things on the internet. And those things have developed because in some ways doctors don't have the time to really do that themselves. And so they're giving patients another resource to look out for it. But I think if we do find that way in which we can communicate with patients in a way that they can understand, they're going to appreciate what's happening in their own body and appreciate what we're trying to do and achieve to help them better, to make them better.
And you know, when you talk about that kind of patient care, it goes towards your practice. And your practice, you, Dr. Moy, actually have added on a new provider, Dr. D'Amato. And I'm excited about that because it's going to offer, again, more access to patients to come in and experience that kind of personal care, and creates time for them to be able to have that kind of expertise.
Yeah, I mean, we're very excited for Dr. D'Amato to join our team. And, you know, we have a great team, clinical team in our practice. I mean, our nurse practitioners and physician assistants have been very helpful. The physician assistants that we have here in the hospital with Selen Abraham, who's been with us for a long time, has been top notch. They're dutiful. They're super nice to patients. They're very approachable, and they're intelligent. That it's really going to help us highlight what we can do for patients in this community. I feel very fortunate that we're surrounded by this level of care in our practice.
Beautiful. So let's talk about what a couple of the new things that you guys have brought into play here. The first thing let's talk about is ureteroscopy and lithotripsy, the program that you guys have put together.
Yeah, I think this is going to be a really innovative, patient-centered type of program, because what I think about when I think about stone disease, what happens is that so many patients are having this acute episode, and they really feel like they're dying.
Yes.
Right? They have
Kidney
no idea
stones.
what's happening. They end up going to the emergency room, right? Because I mean, you really think you're going to die, so you got to find out what's going to happen. And they go to the emergency room and they get taken care of. They're getting given pain medications. Diagnosis is made, but the actual treatment of it, or the prevention, the education of it, is not there. And one of the things that we're trying to do to enhance the patient experience is to make sure that all those patients get follow-up with our practice.
Right.
And so we're trying to, because when you look at some of our data, a lot of these patients get treated in the emergency room, and then they're off to fend for their own devices.
Right.
And so our goal now is to have an avenue in which patients can enter into our practice in a more seamless manner, so that they're not out there without being cared for and having these recurrent problems. And the thing about our stone program here is that Dr. Moy and I have really taken a part in embracing the newest technology for stone disease.
Yeah.
And we're great to have a partnership with Trinity Health in New England, in that we can offer these types of things. And there have been great advances in the laser technology that we have, in which we can do things again in a much more minimally invasive way that can help patients recover quicker and get back to a normal life in a much more seamless way than we did before. And I think it's really going to help patients in this community feel a lot better, do a lot better, and take care of their stone disease. But at the same point, Dr. Moy and I are also really focused on prevention of these types of things as well. So not the diagnosis of it, the treatment of it is one thing, but to also focus on why these things are happening, why someone makes stones, and how we can prevent them from getting stones in the future. So that's our big goal as to what we're trying to do as far as kidney stone disease in this community.
And I really appreciate that, even from a patient perspective, understanding what's going to prevent me from having that problem in the first place. It's almost like you don't want me to see you again in the future, which is kind of like, if I think about health care, many a times in today's industry we think, oh, doctors just want us to come back. Oh, just follow up in 3 months, follow up in 3 months. If you get another one, just come back. But what you in your practice is, you're actually trying to educate further so that they almost don't have to come back.
I mean, I do think kidney stone, just the statistics of it is that recurrence rates are so high that, we do have kind of a follow-up with patients. And, we hope to make that experience for patients relatively painless, and as far as the time commitment to see us, there are a lot of things that we offer in our practice that I think are unique. In fact, patients are able to get ultrasounds in our office very seamlessly. We don't have to make follow-up appointments for them, to set up an ultrasound at another date. They can it's like one-stop shopping. They can get taken care of for all in one sort of visit. I think the thing about urology that I really like, though, is that it's different than other surgical subspecialties in that, it's a combination of both medicine and medical therapy and medical prevention and surgical therapy. What's part of the duty that we have? So we're involved in all aspects of the urologic process, I guess. So, if somebody comes in with an issue, whether it be for an enlarged prostate or for kidney stones, we can manage that medically. But at the same time, if something does progress and require some sort of intervention, we're all skilled and trained enough to take care of that surgically as well. So there are subspecialties in medicine in which they're kind of focused in certain silos, like they just take care of their medical issues, and then if something happens that requires surgery, they send them to another doctor. But for us, we can sort of do everything within the same four wall, same office and same practice.
Beautiful, beautiful. So one last thing, prostate health. It's a big issue in men's, and especially over the past couple of years. Follow up with regards to that has been a little bit tricky. A quick minute or two just on PSA testing and prostate health for men.
Sure. I mean, so typically what the guidelines are with the American Urologic Association is to start PSA prostate cancer screening at the age of 50, unless somebody has a really strong family history, in which we start that earlier.
Sure.
But the typical thing, and I would encourage all men to seek out their primary care doctor or come to our office and once a year do a PSA and a prostate exam.
Yeah.
There have been some controversy as far as like what PSA is, how do you interpret it, is it diagnostic, is it screening? And I would simply say this, that it's a screening tool. So it's a simple blood test. That's pretty much, it's not a special blood test. It's not an expensive blood test.
Right.
And every lab does it. And I would encourage men, and it's to get one done. And it's not a diagnostic test. It's more of outline what one's risk of prostate cancer is. And so, I tell patients, don't be afraid of it. Just because it's elevated doesn't mean that anyone's going to push you into any sort of treatment.
Sure.
And I always tell patients to divorce the screening aspect of prostate cancer versus the potential complications of a treatment of it. That's a huge gap. First things first is that prostate cancer is still the #1 type of cancer that affects men over the age of 65.
Yes.
And although we've learned so much about it, that there are some patients in which we can proceed with what's called active surveillance. Even if they have prostate cancer, we can watch those. But on the flip side, there are some patients that have more aggressive types of prostate cancer that require treatment. And the only way to know is to see a doctor and get screened and take it from there.
So for the men watching, age of 50,
yeah.
PSA, it's your 50th birthday present along the way. Well, the colonoscopy just got dropped from 50 to 45.
That's right.
So now we've got, so it's not just two things you have to do when you're 50. You get one before 50, and then you get this at 50.
That's right.
Thank you very much, Tony.
Oh, my
really
pleasure.
Appreciate it.
Thanks
Thank
a lot,
you, everybody, for joining us. We'll see you next time on our Facebook Focus.
Thank you.